When I arrived, MSF, or Médecins Sans Frontières, had started a surgical project in Misrata, and the hospital was already existing when I arrived. There was a lot of things to implement in the wards and in emergency, but the surgery, the theatre was complete, and the training of the staff in theatre was complete. We had surgeons, anaesthetists and theatre nurses already there. And we were also supporting in another hospital with some surgical assistance. When I arrived in Misrata, I was in charge, or became responsible of the auxiliary wards to the theatre. So I set up a triage tent, emergency and recovery, and the general ward. As a whole, the service could provide start to finish care for patients injured as a result of the conflict. The patients that we treated for surgical interventions, there was emergency surgical interventions unrelated to the war conflict, which you would have in every community, and then we would get patients direct from the front line. The majority of those procedures were emergency procedures, whether it was wound exploration or there was 1 or 2 laparotomies. And then finally we had a lot of surgery that was secondary referrals from the other hospital, and they were patients that needed follow-up care and a lot of reconstructive care, so split skin grafts, wound deprivements. So the idea of Kasr Ahmed Hospital was to alleviate the health service that was already there and provide care to anyone injured as a result of the conflict. To support this, Médecins Sans Frontières started to give donations to the advanced medical post, which was the frontline clinics. They gave donations of emergency equipment, and then they also provided some training on how to use the equipment they had supplied. So they were doing basic training in insertion of intraosseous needles and insertion of chest drains, and they repeated those trainings so that everyone had an opportunity to attend. And then finally there was a communication service that we set up with Médecins Sans Frontières in the ambulances, so that they can communicate with Kasr Ahmed Hospital to give us some notification of patients coming in. Yeah, there was a patient that we had in probably for the longest duration while I was there. He returned to theatre many times as well. He had extensive injury to his back from a shrapnel wound. He had an entry and an exit wound, and a lot of his muscles of his back were torn from the progression of the shrapnel in his body. He had really bad injury to his back, and possibly, if not managed well, would lose the ability to walk. We managed him at Kasr Ahmed. He returned to theatre 2 or 3 times. We managed his wound, and he eventually left the hospital. He bought cake, and he bought his children, and he was a very nice man, and I wish him all the best. I think that his wounds will heal really well. There's a great deal of support in Libya. They, especially in Misrata, they have family support and colleague support from each other. They're definitely a city that is going to struggle in the long run, but for the moment they're still acutely active. I think that their work and their job keeps them distracted from, if that's protective in a way. I know that regardless of everything that is happening, these people are very willing to work hard. They were very helpful to us, and they were very receptive. They've maintained themselves as a community. It's not broken at all. So, yeah.